right, thank you so much. What a powerful message. Hopefully I can kind of underscore some of the things that Darby brought on. Anxiety, stress. What's interesting is how does that manifest as physical symptoms? I'm seeing a lot of that in physical therapy. Luckily enough to be doing this for over 10 years, so the whole landscape has changed. So I'm going to try to just take you through. There's so much out there, but a lot of the stuff that we're seeing, a lot of stuff that we're refining. I'm a big advocate of education, so hopefully we can kind of take you through some different things. Dr. PT, I'm lucky I've been doing this for over 10 years. I worked with some chronic pain patients. It got me into breathing. I became a yoga teacher. I'm very into the kinetic chain, very into rotary sports, golf, how to create power from the ground up. Being in PT, we're in a unique position. We see people twice a week sometimes, or week after week after week. I have an opportunity to educate, to teach. I'm not just going to put you in a corner and make you squeeze a ball and not tell you why you're doing that. So to me, we're in an interesting part of healthcare because we talk to all of you, but we have the time to really establish habits, break bad ones, do all these different things. And because of the frequency, I really try to make the most of it all the time. So we emphasize education, communication, building rapport, but you got to do it in a lot of different ways. We meet people are so different. I could have the same surgery, the same post-op. I'm going to treat this person very differently than I'm going to treat this person. You have to look at the whole picture, and it's comprehensive. There's so much out there. I thought I could talk about just the role of physical therapy in health, the importance of the evaluation, the bigger picture, the rib cage, breath work, the Rice principle. I'm going to talk about manual techniques. There's a lot out there, and to talk about social media, Google. I mean, there's a lot of non-evidence-based stuff. There's a lot of, unfortunately bad stuff out there that I feel is my job to tease out and educate people that maybe this isn't the best route to do. You can't just trust anything that you find online. So, it's good to kind of, dispel some rumors if you need to. So what is health? I love this conference. I think we all agree this is multidisciplinary. It's a combination of physical, emotional, and mental well-being. It's an intricate relationship between diet, exercise, stress, culture, personality. I'm asking people about nutrition. I'm asking about people, do you drink enough water? What do you do for work? How many kids do you have? All these things are going to go into how I treat somebody. And this is all unique to the individual. This is made very complicated by the internet and by social media. So it's challenging for us to, again, create something that's individualized or not cookie cutter. We really have to treat that individual, and I'm going to treat everybody differently. Everyone's different age groups. I got to treat a 6-year-old one day and then a 75-year-old the next day. It's very different. So how I talk and how I teach changes all the time. Physical therapists with their extensive knowledge of anatomy, physiology, pathology, we're in a prime position to provide wellness and prevention services. Again, I see people multiple times sometimes, and I can teach them a lot. People have bad habits. I try to break them. I try to establish habits. I know a million exercises, but if you don't do them, it doesn't matter, So maybe with some people, I need to get them to do 2 things well and consistently versus I have someone who's very good at exercising. I can teach them other things. They're really good at strength training. Maybe they know nothing about mobility. They know nothing about breathing. So you kind of got to work with people, and we have protocols. We have underlying things we're trying to do, but I'm trying to give them a lesson in life and how to be a good human being sometimes, So some of these bigger concepts. Understanding and explaining pain. Pain science was really big on the scene the last couple of years. We need pain. We don't like pain, but the pain is an alarm system. It's telling us that something's wrong. So we have to explain to people how that works. The whole no pain, no gain thing is totally out the window at this point, unless maybe I'm doing some sort of manual technique, et cetera. But there's a lot that we have to, that people think they learned a long time ago that has since changed. So I try to teach as much as I can. When someone walks through the door, we learned about all these awesome new surgeries and all these amazing procedures, but sometimes when that person comes in, they're an emotional mess, So I have to understand someone, like what's their movement IQ, I call it. Do they exercise? Have they ever exercised a day in their life? What's their base level? Some people come in, they have no experience whatsoever. They got hurt in a trauma. They're scared of exercise. They're scared if I ask them to do something, it's going to hurt them. If I make them do something simple, it flares them up. How do you navigate that? Therapy is up and down. It's not easy. You have to guide these people through the ups and downs and really be able to kind of work on the mental and the social and the physical all at that time. People have high-powered jobs. They have they have a million responsibilities. They have kids. They have all these different things. How can I design a routine that they can digest, that they can actually feasibly do? Because we live in this life where we're always on, right? Everything is always on. How do they decompress? We're always holding tension. When you walk in, I'm assessing how you breathe, how you walk, how you do all these different things. But I really try to teach people, how do you do in the everyday? How do you just stand up? How do you hold yourself? How do you stand in the supermarket? I mean, things like that. You need to have intent. And when you have a million different things going on in your life, you're not present. You don't have any intent. I think we forgot how to be bored. I think we just don't remember, calling my mom, hey, I need to get picked up. I would just sit there and wait. There was nothing else to do. So kind of talking about social media, I can go on my phone and 30 minutes goes by and I don't know where that 30 minutes went. So when people come to therapy, I make them put their phone away. I'm like, we're doing this for an hour. You have to listen to your body. You have to feel things. If I can get you to feel something, I never have to teach you again. So hopefully I'll see you on the street somewhere, Managing expectations, I think, seeing people before surgeries is imperative. Like I can set the stage and be like, this is what's gonna happen. This is how it's gonna feel. You might experience this, you might experience that. So that person, already when they walk into my office, I've read their whole, past medical history. I know everything about them. Maybe they had surgery. I talked to Dr. T about the surgery. I know how the surgery went. So they already feel relief because I'm prepared. I know everything. I'm not guessing. So I think helping people to manage that is gonna give you a great outcome. It's a constant process. It's constantly learning, practicing, refining. I might have one idea of how I want to take something and then I have to change it. You have to be ready to kind of change it if you have to based on the situation. I do love all the sports stuff. It's all connected. I mean, in the past, we used to look very locally. We used to think if you had an elbow problem, it was only an elbow problem. Like I would just look at the elbow, but you can't not look at the rest of the body. If someone's playing a sport and they're only using their arm, that's why their elbow hurts. If you never teach them to look at the bigger picture, they're never going to fix the elbow. So you just can't always look locally. You have to look bigger, and that's what's nice about PT. I have a full hour. Yeah, you're here for a shoulder issue, but how well do your hips move? Let me watch you do something. If this can't move, maybe you're overusing something. I'll never fix it unless I teach you how to make the other big muscles wake up, use those, then you fix your arm, then you fix your shoulder. But if I never fix your hip, maybe you'll never get there. So I'm a detective. It's not always as clear cut and dry as you think it is. You have to look at the bigger picture. It's all connected, not to be cliche. Interacting with the ground is big, right? Gravity pulls on us all the time. We're the only thing that can stand upright. How do people absorb force? How do they walk? How do people create power from the ground? We're pushers. We should push ourselves through life. And when I watch people, I ask things like, everyone's like assessing balance. They're standing on one leg. I'll make them do that, but I'll ask, what's holding you up? What muscles do you feel? It's not just me seeing when you lose your balance, because balance isn't just balance. There's a lot of other things that go into balance, right? So I'm very into understanding what people feel, and if I can get them to feel and I can get them to have intent and move with intent, that's almost better. It's almost like hopefully they can leave me and learn something that they can use forever. Ribcage position's been very, very in the scene, I guess, because of the whole thing we were all taught, right, in the 60s or whenever it was, shoulder back, walk around like this. That changes everything. I'm pushing this here. My ribcage position is changing. It's going to change the orientation of my scapula. So I meet a lot of people who are still just kind of stuck in this posture. In time, my center of mass is all screwed up. My head's going to have to come forward. So we're learning and we're trying to teach people that the ribcage is a dynamic structure. And if I can teach people to center that, a lot of good things start to happen. All my moms out there, you were carrying children, and that kind of shifted your whole center of mass. And instead of someone re-educating you and teaching you how to send yourself back, they hand you the baby, and you're taking care of the baby. And these things can manifest over time, right? So it's a lot of different things at play here. Pressurization, we're 75% fluid basically. So how do you manage flow, and how can you make sure that you're flowing the best that you can? So I'm starting to see a lot of just addressing the bigger picture. Like as much as I want to work on the knee or the ankle, like I can't do that sometimes without looking at this, because if you're like this and you're locking your knees out all day, I can have an amazing PT session. If you just walk out of my clinic walking the same way, it doesn't work. It doesn't stick. So I think, as a PT, you kind of have to look at the big picture, and sometimes it's a big mountain to climb, but if you're going to fix it for sure, and you want to actually get to the root of the dysfunction, you can't put a Band-Aid on it. I'm big into breathing. I think no one really breathes. I think we all hold our breath a lot. I don't know if anyone notices that, but you breathe a lot. You breathe like 20,000 times a day. What are you using to breathe? If you're not using your diaphragm, if you're not stacked up properly, you could be using accessory muscles in your neck to breathe. How am I going to fix your neck pain if you don't breathe correctly? The things on the earth that live the longest, for whatever reason, they breathe the slowest. I think like a tortoise can live to 170 degrees. He breathes 3 times a minute, 4 times a minute. Average human's 15, but if you can slow your breath down, I think there's power in that. And just kind of like Darby said, if you can breathe, take things in, slow things down, we're not always hyper-stimulated. You can decrease blood pressure, decrease heart rate. You can change a lot of these inherent things just in the everyday that we forget about. Inefficient gas exchange. I like to tell people if my rib cage is here, if I can't take a full exhale, how am I going to get my liver and my kidneys and all my organs out of the way so that I can touch my toes? You can't. So, there's a lot to the breath. I'm biased. I'm a yoga teacher, but I do teach how to brace, how to use air to brace yourself. People who lift up heavy things, they use that intra-abdominal pressure. So there's a lot of power in the breathing based on the person that's in front of me. Maybe I need to teach them how to breathe slower. Maybe I need to teach them how to breathe to relax. When I teach stretching, I don't think anyone count anymore. We used to just count to 30, and I kind of scrapped the whole thing. No one's present if you're counting. So breath to me is an important thing, and I like to, assess it in a lot of different ways. So this is big. The Rice Principle, which we're all, I think, familiar with. It was a mnemonic coined by Dr. Gabe Merkin in 1978. He withdrew his support from this in 2014 after learning about the role of inflammation during the healing process. You can kind of read through that. But basically, it can hasten recovery. We are also inclined to use ice. We're finding that ice is honestly only really good for pain relief. So if you're having pain, by all means, use ice, but it's not really doing anything for the healing process. I actually need that first cascade of inflammation to help you heal. This is more kind of sports injuries, things like that. Obviously, if surgery, it's different. If you love ice, I'm not going to scrap it. I'm not going to try to, I'm just going to try to educate and say movement is the medicine. If I can get you moving, I can provide better, circulation. That is helpful moving forward. We have a built-in lymphatic system. It's our built-in sewer system. Moving our muscles contracts lymph, and that's ultimately going to move the lymph and help us to clear away the debris faster. Rest is not optimal, but it is in some cases, obviously, if there's something structural going on. Prioritize pain-free movement, ice or pain. They're coming up with new mnemonics like MEAT or peace and love, which is kind of like protection, elevation, activation, avoidance of NSAIDs and things like that. So, if you have an injury, it's nothing dire. Like, it's interesting, maybe talk to a physical therapist. If you're still able to move in some capacity that's not hurting you, we encourage that you keep moving because in the end, rest could actually lead to more detrimental side effects. I'm a big manual guy. Manual therapy, I think, can be very helpful. You don't need manual therapy, but I think it does help people to get there faster. I think by putting my hands on people, I can create a neurological window to achieve more range of motion, tolerate load. It helps people to calm down. I can diminish pain. I tell people if you're one of those, if you go and get a massage and you need a massage every 2 weeks just to keep you going, this is not a massage problem. Go find a physical therapist who can diagnose why you need that massage. You'd rather, again, just not chase symptoms, find someone who can diagnose it, put you on the right path, and I think that's the better way. This poor woman, she was in a golf cart with her boyfriend. The boyfriend flipped it, and she had a traumatic humeral fracture with all these complications. I don't think she forgave them at all, or still hasn't. But so I did a lot of dry needling and scars. Dry needling is a tough thing in the evidence world because there's a million different ways to do it. I was trained to manipulate the needle, twist the needle, do all these different things. Other people, my colleagues, she's in and out with the needle. It's hard to study to know, there's no consistency really in the application of it. We do know that there's like an uptake of calcium, increased circulation. Some people talk about the twitch. You hit a muscle, right on the spot. The muscle twitches, it releases. So research is limited at best, short-term positive effects. No indications for long-term, but again, the variation is what makes it difficult. Excuse me. If anyone saw the original Karate Kid, they do Mr. Miyagi does like a cupping technique on, I forget his main name, but cupping is another thing that's been around for centuries, right? But it's not well understood. I think Michael Phelps came on the scene and he had all those cupping, marks on his shoulder and stuff like that. We know it utilizes negative pressure to create a suctioning effect. We can't pinpoint exactly why it works. The nitric oxide theory, immunomodulation effects, pain gate theory. We need to substantiate this on a larger randomized controlled trials and things like that. I do use these in my own practice. I have saved a lot of knees and a lot of range of motions and things like that when I couldn't get it. You just need a lot of tools in your tool belt. I don't think any one thing works for everybody. If you have dry needling, if you have cupping and other things, when you get to know your patient, I think you want to have all these at your arsenal if you need them. Lastly, blood flow restriction therapy has been big, obviously, in the realm as well. It uses a belt or a band applied to the proximal portion of an extremity to partially occlude blood flow. So we're playing on the cardiovascular system to get ultimately more of an effect, more hypertrophy, increased growth hormone, things like that. We generally like to use this post-operatively, post-op ACL, trying to get a quad back, maybe there's a patient population where they're having a hard time, garnering strength. We can use it there. We do know it's safe. We've used it in research, on some like higher risk populations, and they all tend to do well with it, even if you have cardiovascular history. So, I guess in short, I think the big thing is, as a profession, I think we have to underscore education. I think we have to teach people. You have to treat the individual in front of you. No one's a cookie cutter. Giving good care, educating them, talking to the doctors, talking to the nurses, all of us being on the same page, I think is paramount to giving the best kind of care that we can give. Thank you.